Great. Well, let me talk about virtual nursing because that's a little bit the topic of the day for us. Is that on one hand, it's like it's a cachet right now, right? And I think part of it was after COVID, travel nursing went up, so there was a budgetary reason, and then there was such a shortage of nurses. People were like, we got to invest in nursing, so virtual nursing became the term of the day. And we've seen things where about half of hospitals say by 2025 they're going to have some level of this in their hospital. At the same time, one thing that's interesting is that we're seeing half of the hospitals that have deployed virtual nursing are saying they're having trouble scaling it right now. And so maybe if you're kind of projecting your crystal ball or looking in through, what do you think is happening that these two factors are occurring at the same time?
Well, I think first of all, everyone initially has had their own idea of what virtual means. And virtual nursing is not a program or initiative to take away the decisions a nurse is making at the bedside. It is really meant to be, one, as a safety check, two, as a way to add a second set of hands, although they are virtual hands, and three, people within the hospitals who are deploying and implementing this really need to start with what's in it for the nurse or for the healthcare provider that's going to want to make them really look into virtual nursing and lean into that as something that can help them. And honestly, probably the two breakthroughs other than virtual sitting have been really looking at what's workload that you can pull away from me at the bedside. That would really make my day easier. And when you think of admissions for patients, and you also think of discharging patients and patient education, that's something that people can really get their eyes and hands around and realize if there is a virtual nurse doing that work, I, as that bedside caregiver, have many other things that I can refocus on that need someone there in the room to observe and watch and really do some critical thinking and thinking on their feet with the use of someone in the background. We've also seen it in some instances of being such a wonderful mentor. It's like having a preceptor by your side at all times. And it's not there to say, I caught you. It's there to say, I'm here to help you as that second set of hands, a way of feeling safe in the environment that you thought might have been unmanageable without virtual nursing.
What do you think then is causing, if you had to guess, why do you think people are having trouble scaling it then?
Well, I think that we've tried to adopt it in too much of a mass go live. Get a unit, pick a department, pick an area where you've got the perfect setting of where to deploy this and people can see it's really working. And then allow the nurses that are involved in it, from whether they're the virtual nurse or the hands-on nurse, to describe what they've done to make their workday, their ability to leave work and feel like they've done a good job that day. And if we use those examples and really allow that to be the platform for change, we will be able to get somewhere, I think, more quickly than a deployment.
Reminds me of something the CEO of Salesforce, Mark Benioff, used to say to me, which is less changes in a year than you think and more changes in a decade than you can imagine, right? And it feels like that you're describing that kind of piece.